Hi guys, this is just a very quick video to give you some background on your literature review project. So in our group we have a project that is based on the problem that Indigenous communities have with rheumatic heart disease. So you probably aren't aware that it's one of the major problems with the Indigenous population. So when they have a strep A infection, the bacteria attacks the heart valves, and so it mainly affects children from the age of 5 or 6 up until around the age of 21. And so if you have repeated episodes of the strep A infection, then it requires you to have open heart surgery, which as a teenager is not much fun, as you can imagine, and it's a big problem with Indigenous populations both in Australia and in Sub-Sahara, India, all of those sort of lower socio-economic areas. And so the project, or the current treatment is that as soon as a child's had the strep A infection, they have a penicillin G injection once a month straight into the gluteus. So you can imagine getting children to come back to have an injection in their backside once a month is not easy at the best of times, let alone with an Indigenous and possibly nomadic population. So it's a big problem, and so we're trying a few ways of getting around that problem, and one of them is to have an implant that provides sufficient protection to last for say 6 months to 12 months. And so the idea would be that rather than having the monthly injections, that we would have a implant that would last for up to a year, and then the patient would have to come back and have a new implant put in. And so the reason that we've titled your project as surgically implanted implants is because the likely size of the implant is maybe 3 or 4 grams, 3 or 4 mils, 5 mils as a minimum. The reason for that being that we know the minimum plasma concentration to provide the protection, and if you model the pharmacokinetics, it falls out that you need around 2 to 2.5 grams of drug to last for the 6 months, to provide if there's a constant input rate from the implant, then that's the total dose of drug that you need to keep the patient above the MIC, so the minimum inhibitory concentration for protection against the strep A. So we're looking at quite a big implant, and there's a lot of issues around that. And so what we'd like to do, I guess, is divide up your project into those different issues, and so someone can tackle each of those problems separately, and we'll discuss how we divide that up when we have our meeting next week. So I look forward to speaking to you more about it then. Hopefully this helps to clarify the reasoning behind the project. Cheers.